Hello friends, today we will learn about Salmonella. Myself Rajeshwari, I will teach you about Salmonella. It's the morphology, culture, biochemical reactions, resistance, antigenic structure, antigenic variation, classification, Kaufman's white scheme, toxin, pathogenesis, epidemiology, laboratory diagnosis, bacteriophage typing, biotyping, plasmid typing, treatment, drug resistance, and prophylaxis. Next, we will study about Salmonella gastroenteritis. Under this, we will study about sources of infection, clinical features, laboratory diagnosis, control, and treatment. Then we will study about Salmonella septicemia. So let's begin. The Salmonella are primarily intestinal parasites of vertebrates and which infect man, leading to enteritic fever, enteritis, and septicemia. The most important member is typhi, Salmonella typhi, the causative agent of typhoid fever. Typhoid fever. Man is the only natural host for S. typhi, Salmonella typhi, in short S. typhi, and S. paratyphi A, whereas most of the other Salmonella are chiefly pathogenic in animals like poultry, pigs, and cattle, etc. Salmon and Smith in 1885 isolated the hog cholera bacillus, and the term Salmonella was coined from the name of salmon. Interestingly, hog cholera disease was subsequently proved to be a viral infection in which S. cholerae shoes was a common secondary invader. Now let's know about Salmonella. Salmonella produce three main types of disease in human being. First is enteritic fever, that is the causative agent of enteric fever are Salmonella typhi causing typhoid fever or Salmonella paratyphi A, B, C causing paratyphoid fever. The term enteric fever includes both typhoid and paratyphoid fever. Let's know about gastroenteritis. Salmonella under this group are essentially animal parasites but can also infect man. These include S. diffimurium, S. enteritis, S. Newport, S. Dublin, and Thompson, S. Thompson. Now let's know about septicemia. The commonly associated Salmonella is S. cholerae suis, but other species may also cause septicemia. Now let's know about morphology. Let's know about its morphology. Salmonella are gram-negative bacilli measuring 1 to 3 micrometer into 0.5 micrometer. They are motile, non-sporing, and non-capsulated. Motility is due to the presence of peritrichous flagella except S. gallinarum and S. puror- pulorum, which are non-motile. Now let's know about the culture. Salmonella grow on ordinary culture media at optimum temperature of 37 degrees centigrade, range 15 to 41 degrees centigrade. Its pH should be 6 to 8 and are aerobic and facultative anaerobic. They produce colonies of 2 to 3 mm in diameter, circular, translucent, low convex, and smooth. On McConkey's agar and deoxycholate citrate agar, in short DCA, colonies are colorless due to non-lactose fermentation, in short NLF. On Wilson and Blair bismuth sulfide medium, jet black colonies with metallic sheen are formed due to formation of hydrogen sulfide. S. paratifi A and other species which do not form H2S produce green colonies. Xylose lysine deoxycholate agar is another medium used for isolation of this organism. Most strains of Salmonella produce red colonies with black centers when grown on this medium. H2S negative H2S negative serotypes of Salmonella produce red colonies without black centers. Selenite F broth and tetrathionate broth, in short TTB, are commonly used enrichment media for inoculation of specimens, especially fishes. Now let's know about biochemical reaction. Salmonella ferment glucose, mannitol and maltose forming acid and gas except S. typhi, Salmonella typhi, which produces only acid and no gas. They do not ferment lactose or sucrose. Indole is not produced. Most Salmonella produce H2S in triple sugar iron agar except S. typhi A and S. cholerae suis. This utilize citrate except STF and S paratifi A and are MR positive and VP negative. Urea is not hydrolyzed. Common biochemical reactions of Salmonella we can study. Now let's know about resistance. Resistance. The Salmonella are killed at 60 degrees centigrade in 15 minutes. Boiling, chlorination of water and pasteurization of milk destroy the bacilli. They survive in water, ice and snow for weeks and months. They are killed within 5 minutes by mercury chloride. Mercury chloride 0.2% or phenol 5%. Next point is antigenic structure. Salmonella possess three types of antigens based on which they are classified. These are: first is flagellar antigen, in short H, and second is somatic antigen, that is O, and a surface antigen, that is BI, found in some species. Several strains possess fimbriae. Fimbrial antigens are not important in identification, but confusion may be created due to their non-specific nature and widespread sharing among enteric bacteria. Now let's know about H antigen. This antigen is present on the flagella and is a heat labile protein. What is this? This is a heat labile protein. The H antigens of Salmonella are not shared by other enterobacteria. It is destroyed by boiling or by treatment with alcohol and acids, but not by formalin. It is strongly immunogenic, and when mixed with antisera, H agglutination occurs rapidly, producing large, loose, fluffy clumps. Flagellar antigens are present in two forms called phase 1 and phase 2. Now let's know about second type, that is O antigen. The somatic O antigen is lipopolysaccharide complex which forms an integral part of the cell wall. It is identical with endotoxin. It is heat stable and is present both in motile and non-motile bacilli. It is resistant to boiling, alcohol and weak acids. When mixed with antisera, O antigen suspensions produce compact, chalky, granular crumbs. O antigen is less immunogenic than H antigen. The titer of O antibody in serum after infection is or immunization is generally less than that of H antibody. Anti-O antibody is predominantly IgM. Agglutination occurs more slowly and at a higher optimum temperature, 50 to 55 degrees centigrade. Then H antigen H agglutination, that is 37 degrees centigrade. 67 different O antigens have been recognized and they are designated as 1, 2, 3 like this, etc. And now let's know about VI antigen. Many strains of S. diffi possess surface antigen envelope, envelope, enve- enveloping the O antigen referred to as VI antigen. Hence, this antigen interferes with agglutination of freshly isolated strains with O antisera. Felix and Pitt, who first described the antigen, believed that it was related to virulence. It is analog to K antigen of coliform bacteria. VI antigen is heat labile and is destroyed by boiling or heating at 60 degrees centigrade for 1 hour. It is also destroyed by HCl 0.5 N NaOH, sodium hydroxide, and phenol. It is unaffected by 0.2% formal or alcohol. Besides STP, the VI antigen with similar specificity is also present in paratyphi C, S. dublin, and certain strains of Citrobacter. The VI antigen is lost on cereal subculture. The VI antigen acts as a virulence factor by inhibiting phagocytosis, resisting complement activation and lysis of bacteria by the alternative pathway. It has been demonstrated that strains with VI antigen produce clinical disease more consistently than those without VI antigen. The VI antigen is poorly immunogenic and induces production of low titer of antibody following infection. Detection of VI antibody is not helpful for diagnosis of enteric fever and hence is not employed in the Widal test. The total absence of VI antibody in a proven case of typhoid fever indicates poor prognosis. The VI antibody disappears in early phase of convalescence. Persistence of this antibody indicates the development of the carrier state. Specific VI bacteriophages are used for epidemiological typing of STP. In prophylactic vaccination with TABC, no VI antibody is induced by phenolized vaccine, though low titers of the antibody are produced by alcoholized vaccine. Now let's know about antigenic variation. The antigen of Salmonella undergo several types of phenotypic and genotypic variations. Now let's know about H versus O variation. Motile strains lose their flagella and become non-motile. When salmonella are grown on nutrient agar media containing phenol 1 is to 800, flagella are inhibited. This change is phenotypic and temporary since flagella reappear when the strain is subcultured on normal media without phenol. Salmonella may rarely lose flagella by mutation. A stable non-motile mutant is 901 to O strain of S. diffi, which is widely used for the preparation of O agglutinable bacterial suspension. Generally, loss of flagella is not total but only a diminution in the number of flagella occurs. Such bacteria cultures contain small number of flagellated cells. To obtain motile bacteria rich in H antigen from such cultures, selection may be carried out by use of Chrysis tube. This consists of a wide tube containing 0.2% nutrient agar in which a short narrow tube open at both ends is kept embedded in such a way that one end of its project above the agar. The stain is inoculated into the inner tube and after incubation, subcultures are taken from the top of agar outside the central tube. This yields motile bacteria with rich H antigen. Instead of Kragg's tube, a U tube of soft agar may also be used. Inoculation of stain is made into one limb of U tube and subculture is taken from the other limb. Now let's know about phase variation. The flagellar antigen of most Salmonella occur in one of two phases, phase 1 or phase 2. Phase 1 antigens are either specific or shared by a few species only, and hence phase 1 is called specific phase, and phase 2 antigens are widely shared by several unrelated species of Salmonella. Hence, phase 2 is called the non-specific or group phase. Phase 1 antigens are designated as A, B, C, D, etc. up to Z, and after Z as Z1, Z2, Z3, Z up to Z14. Phase 2 antigens and are fewer and termed as 1, 2, 3, etc. In some species, antigens of phase 1 may occur as phase 2 antigens. Strains that possess both phases are termed diphagic, while some strains, STP like S. enteritidis, S. dubulin, and S. paratife A occur in phase 1 only and are called monophagic. A culture will contain flagellar antigens of both phases, but generally one of the two phases predominates so that the culture is agglutinated only but one of the phase antisera. For identification of a serotype, it is necessary to identify the flagellar antigens of both phases. A culture in one phase can be converted to the other phase by passing the bacteria through a Krajis tube containing the homologous phase antiserum incorporated in the agar. Now let's know about V versus W variation. Fresh isolated Fresh isolates of STP carries VI antigen that completely mask the O antigen. These isolates are agglutinable with VI antiserum but not with O antiserum. There are these are called the V forms. Organisms lost their VI antigen either partially or completely after a number of subcultures. When there is a complete loss of VI antigen, such cultures are agglutinable by O antiserum but not with VI antiserum. These are called W forms. With partial loss of VI antigen, the bacilli are agglutinable with both VI and O antisera and are called VW forms. Other VI containing bacilli seldom have the O antigen completely masked by VI antigen. Now let's know about S versus R variation. The smooth to rough variation, SR means smooth to rough variation, occur due to mutation and are associated with the change in the colony morphology from smooth to rough. Loss of the O antigen and of virulence of the stain. The rough R variants have defective capacity to synthesize somatic antigen and loss of O antigen may be partial or total. R forms may be common in laboratory strains maintained by serial subcultures. S smooth to rough variation may be prevented to some extent by maintaining laboratory cultures on Dorset's egg media in cold or by lyophilization. Now let's know about variation in O antigen. Changes in the structural formula of O antigen may be induced by lyogenization with some bacteriophages, resulting in the alteration of the bacterial serotypes. Thus, anatom serotype 310 is to EH is to 1 6 is converted into Newington serotype 315 is to EH is to 1 6 by phase 15. Newington is further converted into S. Manning Police serotype 315 34 is to EH is to 1 6 by phase 34. Such changes are taking place in nature which might be responsible for so many serotypes of Salmonella. Now let's know about the classification. The genus Salmonella is classified broadly into 4 subgenera on the basis of biochemical reactions. Subgenus 1 is the largest and the most important group containing all the species that are commonly responsible for human and animal infections. Other subgenera have little importance in human disease. Subgenera 2 is common in reptiles and subgenera 3 in lizards. Subgenera 4 strains are rarely encountered and are considered as atypical members of subgenera 2. The bacilli of subgenera 3, formerly designated as Arizona and later included in the genus Salmonella because of their antigenic similarity. About 60% of them ferment lactose promptly. Modern taxonomical techniques have shown that all the members of genus Salmonella belongs to all species S. enterica and S. Bongori. S. enterica is classified into 6 subspecies, namely Enterica salmei, Arizona, Diarizona, Hautenia, Hauteni indica, Hauteni and indica. Subspecies Enterica corresponds to former subgenus 1. S. enterica, subspecies Enterica includes the typhoid, parathyroid bacilli and most other serotypes responsible for human diseases. According to this, the taxonomical correct name for the typhoid bacillus would be Salmonella enterica. Subspecies Enterica, serotype typhi. Serotype name should be given in Roman and not in italics. This classification and nomenclature is taxonomically correct but would be too complicated for use in clinical bacteriology. Therefore, the old species names are still being used in clinical bacteriology. Salmonella are classified serologically by Kaufman-White scheme. Kaufman-White scheme. Let's know about Kaufman-White scheme. It forms the basis of serotyping of Salmonella based on identification of O and H antigens by agglutination. Salmonella are classified into groups based on distinctive O antigen factors. The distinctive factor for group A is 2, for group B 4 and for group D 9. Any strain possessing factor 2 will be classified as possessing as group A and any strain possessing factor 9 as group D. Salmonella are divided into 67 O groups. Each is designated by letters A to Z and those discovered later by the numbers. Within each group, further identification and differentiation is by phase 1 and phase 2 flagellar antigens. In Kaufman's white scheme, each serotype is given a species status. There are about 2,300 serotypes of Salmonella. Most serotypes of medical importance belong to group A and E. The Salmonella species are originally named after the place of isolation: S. Newport, S. Panama, S. Puna. After the disease caused by them, S. Scott Mullery, and after the name of the person from whom the first strain was isolated, S. Thompson. Sometimes more than one species, that is S. gallinarum and S. pulorum, may have the same antigenic formula and cannot be distinguished serologically. Differentiation can be done by biochemical reaction. S. gallinarum is anaerogenic and ferments dulcital, unlike S. pulorum. Important pathogens can be further typed for epidemiological purposes by phase susceptibility, biochemical reactions, bacteriocin production, and antibiogram. Now let's know about the toxin. Like all the gram-negative bacilli, the cell walls of Salmonella contain lipopolysaccharides which acts as endotoxin. Now come to let's know about pathogenesis. STP, S. paratifi A and usually S. paratifi B are confined to human beings. The majority of other Salmonella are primarily infective for animals and human beings are secondarily infected. Salmonella cause three types of clinical syndrome in human beings: enteric fever, septicemia, and gastroenteritis. Now let's know about enteric fever. The term enteric fever includes typhoid fever, STP, and paratyphoid fever. S. paratyphi A, B, C. Infections due to STP and S. paratyphi A are prevalent in India. Now let's know about typhoid fever. The infection is acquired by ingestion through contaminated food and water. The incubation period is usually 7 to 14 days but appears to be related to the dose of infection. On reaching the small intestine, the bacilli attach to the epithelial cells of the intestinal villi and penetrate to the lamina propria or submucosa. They are phagocytosed by neutrophils and macrophages. These bacteria resist intracellular killing and multiply within these cells. They enter the mesenteric lymph nodes, multiply there and via the thoracic duct enter the body bloodstream. Enter the bloodstream. A transient bacteremia follows and internal organs like liver, gallbladder, spleen, bone marrow, lungs, lymph nodes, and kidneys are infected. Towards the end of the incubation period, a massive bacteremia occurs from these sites of multiplication and clinical disease sets in. Salmonella multiply abundantly in the gallbladder as bile is a good culture medium for the bacillus. These bacteria are discharged continuously into the intestine, involving the Peyer's patches and lymphoid follicles of ileum. These become inflamed, necrosed, and sloughed off, leaving behind the typhoid ulcers. These ulcers may lead to two major complications: intestinal perforation and hemorrhage. During the course of the disease, 3 to 4 weeks, the intestinal lesions undergo healing. The clinical course may vary from a mild pyrexia to a fatal fulminating disease. The illness is usually gradual with headache, anorexia, and congestion of mucous membrane. The characteristic features are hepatosplenomegaly, stepladder, leukopenia, skin rashes known as rose spots may appear during the second or third week. The infecting organism appear in stool during second to third week and in urine during third to fourth week. Rose spots appear on the skin during the second or third week. Now let's know about paratyphoid fever. Paratyphoid fever resembles typhoid fever but is milder. S. paratyphi A, B and C cause paratyphoid fever. S. paratyphi C more often leads to a frank septicemia with superactive complications. Some other salmonella have also been reported to cause enteric fever occasionally. These include S. dublin, S. barley, S. eastbourne, S. St. Paul, S. Oranienburg and S. Panama. Now let's know about septicemia. Salmonella septicemia are commonly caused by S. cholerae suis or S. paratyphi C and occasionally by other salmonella. Infection occurs through oral route. There is early invasion of bloodstream and it produces local suppuration in different organs. It may cause osteomyelitis, pneumonia, pulmonary abscesses, meningitis, or endocarditis. Now let's know about gastroenteritis. Salmonella gastroenteritis or food poisoning is caused by ingestion of food like meat, milk, egg contaminated by certain salmonella, which are primarily animal pathogens. Eggs and egg products are of great concern. Now let's know about gastroenteritis. Salmonella gastroenteritis or food poisoning is caused by ingestion of food like meat, milk, egg contaminated by certain salmonella which are primarily animal pathogens. Eggs and egg products are of great concern. Salmonella can enter through the cell if eggs are left on fishes or contaminated feed of chicken. S. typhimurium is the most frequently isolated in food poisoning. The other common species responsible are S. enteritidis, S. newport, S. Senftenberg, S. Dublin, S. Heidelberg, and S. Indiana. Now let's know about epidemiology. Enteric fever is endemic in all parts of India. Typhoid fever is commoner than paratyphoid fever. S. paratyphi A is prevalent in India. S. paratyphi B is rare and we see very rare. Enteric fever occurs at all ages but is probably most common in the 5 to 20 years age group. The faces of carriers are important source of contamination of food and drink rather than the frank clinical cases. Sewage contaminated by a carrier is responsible for polluting drinking water. Food material gets contaminated via polluted water or by the hands of carriers. Mary Mallon, Typhoid Mary, a cook in USA, was a famous carrier who caused several outbreaks over a period of 15 years. Now let's know about laboratory diagnosis. Bacteriological diagnosis of enteric fever consists of isolation of bacilli, demonstration of antibodies, demonstration of circulating antigen, Other laboratory tests. Now let's know about isolation of bacilli. This may be done by culture of specimens like blood, fishes, urine, aspirated duodenal fluid, etc. Selection of a relevant specimen depends upon duration of illness, which is very important for the laboratory diagnosis of enteric fever. Now let's know about blood culture. Blood cultures are positive in approximately 90% of cases in first week of fever, 75% in the second week, and 60% in the third week. Positivity rate declines thereafter, and blood cultures remain positive in 25% of cases till the subsidence of pyrexia. 10 ml of blood is collected by venipuncture under aseptic conditions and transferred into blood culture bottles. Glucose broth and taurochlorate broth. Both before transferring blood into blood culture bottles, caps of these bottles should be thoroughly cleaned with spirit or alcohol. Blood should be transferred through a hole in a cap by inserting the needle of the syringe rather than opening the bottle. Thus, it avoids contamination from the external environment. Blood contains substances that inhibit the growth of the bacilli, and hence it is essential to dilute out these substances. 5 ml blood into 50 ml culture media, that is 1 is to 10 dilution. Alternative is addition of liquid sodium polyethanol sulfonate, which counteracts the bactericidal action of these substances. Both blood culture bottles are incubated at 37 degrees centigrade for overnight. The glucose broth is subcultured on blood agar, and the taurochlorate broth on McConkey's agar. Taurochlorate broth is inhibitory to gram-positive bacteria, therefore gram-negative bacilli are selected out. Pale non-lactose fermenting, that is NLF colonies appear on McConkey's agar and are picked out for biochemical reactions and motility. If Salmonella are not obtained from the first subculture from taurocolate broth, subculture should be done every other day up to 10 days before declaring the culture as negative. Sometimes Castaneda method of culture is practiced instead of routine blood culture. Now let's know about clot culture. It is an alternative to blood culture. 5 ml of blood is withdrawn aseptically into a sterile container and allowed to clot. The serum is separated and used for the Widal test. It is an alternative to blood culture. 5 ml of blood is withdrawn aseptically into a sterile container and allowed to clot. The serum is separated and used for the Widal test. The clot is broken up with a sterile glass rod and added to bile broth containing streptokinase, that is 100 units per ml, which digests the clot causing its lysis, and thereby the bacteria are released from the clot. Serum used for Widal test may be negative due to the early stage of the disease, but it may be useful as baseline titer against which the results of tests performed later may be evaluated. Now let's know about feces culture. Salmonella are shed in the feces throughout the disease and even in convalescence due to lesions present in the intestine. Hence, fecal culture may be helpful in patients as well as for the detection of carriers. These are particularly valuable during antibiotic therapy when blood culture shows no growth of organisms. The antibiotic does not eliminate the bacilli from the gut as rapidly as it does from the blood. Fishes culture. Let's know about fishes cultures. Fishes cultures are generally positive after the second week of illness. As normal flora is present in fishes, successful culture will depend on the use of enrichment and selective media. Fish fecal samples are inoculated into one tube each of selenite and tetrathionate broth and are also plated directly on McConkey's agar, DCA, XLD and Wilson Blair media. Salmonella appear as pale yellow insert NLF colonies on McConkey agar and DCA media. On Wilson's Bayer medium, STP forms large black colonies with a metallic sheen, whereas Paratifi A produces green colonies due to the absence of H2S production. Enrichment media are incubated for 6 to 8 hours before subculture onto selective media such as McConkey's agar and DCA. These selective media are then incubated at 37 degrees centigrade for overnight. Now let's know about urine culture. Urine culture is less frequently positive than the culture of blood or feces. Cultures are generally positive only in the second and third weeks. After third week, only about 25% cases may be positive. Repeated cultures improve the chances of isolation. Urine samples are centrifuged and the deposit is inoculated into enrichment and selective media. Now, let's know about other specimens for culture. Bone marrow culture is valuable as it is positive even when blood cultures are negative. Culture of bile is usually positive and may be useful in detection of chronic carriers. Other materials which may be used for culture are rose spots, discharge, pus from suppurative lesions, CSF and sputum. At autopsy, cultures may be done from the gallbladder, liver, spleen, and mesenteric lymph nodes. Now, let's know about colony morphology and staining. On McConkey's agar or DCA, Salmonella grow as pale yellow, non-lactose fermenting colonies. Gram staining from these colonies show gram-negative bacilli, and on hanging drop preparation, these are motile bacilli. Now, let's know about biochemical reactions. Salmonella are catalase positive, oxidase negative, nitrate reduction positive, and ferment glucose, mannitol but not lactose or sucrose. STP ferments glucose and mannitol with production of acid only, but paratyphoid bacilli form acid and gas. Now let's know about slide agglutination test. A loop full of growth from a nutrient agar slope is emulsified in 2 drops of saline on a microscopic slide. On one, emulsion acts as a control and other as a test. Control is to show that the strain is not auto-agglutinable. Agglutination is first carried out with the polyvalent O and polyvalent H antisera. Positive agglutination indicates that the isolate belongs to genus Salmonella. Further agglutination tests are done with single factor sera for determining the O and H antigens. If HTP is suspected, that is when no gas is formed from glucose and mannitol, agglutination with O antiserum factor 9 is done. Prompt agglutination indicates that the isolate belongs to group D Salmonella. Its identity as STP is established by agglutination with H antiserum anti-D serum. Sometimes fresh isolates of HTP are in V form and do not agglutinate with O antiserum. Such strains should be agglutinated with anti-VI serum. Alternatively, the bacterial suspension in saline is boiled for 20 minutes, which removes the VI antigens from the organism. The boiled bacterial suspension is then tested with poly-O antiserum. When the isolate is a non-typhoid Salmonella producing gas from carbohydrates, it is tested for agglutination with O and H antisera for group A, B and C. For identification of unusual serotypes, the help of a national Salmonella reference center at the Central Research Institute CRI, that is Kausali, maybe South. The reference center for Salmonella of animal organ is located at the Indian Veterinary Research Institute, Nagar. Now let's know about demonstration of antibodies. Widal test. Let's know about the Widal test. It is an agglutination test for detection of agglutinins H and O in patients with enteric fever. Salmonella antibodies start appearing in the serum at the end of first week and rise sharply during the third week of enteric fever. Two specimens of sera at an interval of 7 to 10 days are preferred to demonstrate a rising antibody titer. Now let's know about the procedure. Two types of tubes were originally used for the test: Dreyer's tube for the H agglutination and Felix tube for the O antigen agglutination. Equal volumes, that means 0.4 ml of serial dilution of the serum, 1 is to 10 to 1 is to 640, 1 is to 640, and the H and O antigens are mixed and incubated in a water bath at 37 degrees centigrade for 4 hours and read overnight refrigeration at 4 degrees centigrade. Control tubes containing the antigen and normal saline are included to check for auto-agglutination. H-agglutination leads to the formation of loose cotton wool clumps, while O-agglutination appears as a granular deposit at the bottom of the tube. The highest dilution of the serum showing agglutination indicates the antibody titer against the particular antigen. Control tube show a compact deposit. That means bottom formation. The antigens used in the test are the H and O antigens of STP, TH and TO antigens. The H antigens of S paratyphi A, that is AH antigen, and the S paratyphi B, that is BH antigen. The paratyphoid O antigens are not employed as they cross react with S typhi O antigen TO due to their sharing of factor 12. Now let's know about preparation of viral antigen. The H-agglutinable suspension of bacteria is prepared by adding 0.1% formalin to a 24-hour broth culture or saline suspension of an agar culture. For preparation of O suspension of bacteria, the bacillus is cultured on phenol agar 1 is to 800. The growth is scraped off in a small volume of saline and mixed with 20 times its volume of absolute alcohol. It is then heated in a water bath at 40 degrees centigrade to 50 degrees centigrade for 30 minutes, centrifuged and the deposits resuspended in saline on the appropriate density. Chloroform is then added as a preservative. STP 901 O and H strains are used for preparation of antigens. Each batch of prepared antigens should be compared with a standard and viral kits of stained antigens are available commercially. Now let's know about the result. The highest dilution of patient serum in which agglutination occurs is noted, that is, if the dilution is 1 in 160, the titer is 160. Now let's know about the interpretation of viral test. The agglutinin means antibody titer, depends on the stage of the disease. Agglutinins usually start appearing in the serum by the end of the first week, so that blood specimen taken earlier than first week may give a negative result. The titer rises steadily till the third or fourth week, after which it declines. Rising titer. Demonstration of a four-fold or greater rise in the titer of both H and O antibodies at an interval of 7 to 10 days is more meaningful and diagnostic than a single test. Now let's know about the single test. O titer is 1 is to 100 or more, and H titer is 1 is to 200 or more, signifies presence of active infection, but that has to be interpreted with caution, considering some factors. Let's know about these factors. First is local titer. The endemic area low titer of agglutinins is present in the serum of normal persons. This normal titer differs from place to place. Local titer of that place should be known before interpreting the result of a single test. Now let's know about immunization. In immunization with TAB vaccine, individuals may show high titer of antibody to S typhi, S paratyphi, A and B, while in case of infection, antibodies will be seen only against the infecting organism. Now, age agglutination. In non-immunized individuals, presence of H-agglutinin in serum indicates enteric fever or a latent infection. H-agglutinin is more reliable than O-agglutinin, as O antigen is common in all the Salmonella. Anamnestic reaction. Persons who have had past enteric infection or immunization may develop anamnestic reaction during unrelated fever like malaria, etc. In such cases, a transient rise in H antibody occurs, whereas the rise in sustained in enteric fever. This may be differentiated by repeating the viral test after a week. Now let's know about febrile antigens. Bacterial suspensions used as antigens may contain febrile antigen, which may produce false positive results. Now let's know about effect of treatment. Cases treated early with chloramphenicol may show a poor antibody response. If the antibody is already present, no further rise in titer is expected. Now let's know about the carriers. Test may be positive in many healthy carriers. Now let's know about the other serological test. ELISA is a ELISA means enzyme linked immunosorbent assay, is a sensitive method of measuring antibody against the lipopolysaccharide of Salmonella. Indirect hemagglutination test and CIEP are the other serological test methods of diagnosis. Detection of porins, the outer membrane protein of STP by ELISA method is useful for early serodiagnosis of typhoid fever. Now let's know about the demonstration of circulating antigen. Typhoid bacilli antigens are present in the blood in the early phase of the disease and also in urine of patients. The antigen can be detected by coagulation test. Staphylococcus aureus containing protein A is first established with formaldehyde and then coated with S-Tiffy antibody. These sensitized staphylococcal cells are mixed on slide with patient serum. The typhoid antigen present in the serum combines with the antibody coated on staphylococci producing visible agglutination within 2 minutes. The test is rapid, sensitive, and specific, but is positive only during the first week of the disease. Counter electrophoresis, in short, CIEP and ELISA have also been employed to detect typhoid antigens in blood and urine. Now, let's know about other laboratory tests. TLC. First is TLC. TLC means total leukocyte count. Leukopenia with a relative lymphocytosis is found. Next is second disease test is diazo test in urine. This test becomes positive generally between 5th and 14th day of fever and remains positive till the fever subsides. Now let's know about the procedure. Equal volumes of patient's urine and the diazo agent are mixed and few drops of 30% ammonium hydroxide are added. On shaking the mixture, a red or pink froth develops if the test is positive. Now let's know about the diazo reagent. For solution A contains sulfonylilic acid, concentrated H2SO4, distilled water. Solution B contains sodium nitrite and distilled water. For use, 40 parts of solution A are added to 1 part of solution B. Now let's know about the diagnosis of carriers. Carriers are important sources of infection and their detection is necessary for epidemiological and public health purposes. Laboratory methods are also very useful in screening and food handlers for detecting carrier select. Even after clinical recovery, about 2 to 3% patients in convalescence phase and some persons with subclinical infection continue to excrete the bacilli in feces for about 2 months to a year. Chronic carriers harbor the bacilli in gallbladder or rarely in intestine or urinary tract. Most of these carriers continue excreting organisms after 1 year of convalescence and may continue to excrete the bacilli for several years or throughout life. In most of these cases, there is intermittent shedding of bacilli in stool. Therefore, repeated stool cultures may be helpful to detect the bacilli. Collagogus purgatives increase the chance of isolation from stool specimens. Other useful specimens for culture are bile and duodenal drainage. For the detection of urinary carriers, repeated urine culture should be done. Vital test is of no value in detection of carriers in endemic countries like India. Antibody to VI antigen in serum is claimed to indicate the carrier state. This may be used for mass screening. However, confirmation should always be made by culture. Sewer swab technique is used for the tracing of carriers for epidemiological purposes. Gauze pads left in sewers and drains are cultured and the positive swab may lead to a house harboring a carrier. Organism isolated harboring organisms isolated from carrier is to be phase typed to establish the carrier as a cause of an epidemic. Another method of isolation is filtration of sewage through millipore membranes and cultured the membranes on highly selective medium, example Wilson and Blair medium. Now let's know about the bacteriophage typing. Let's know about bacteriophage typing. For epidemiological purposes, strains may be differentiated into a number of phage types. Kragi and Yen, two scientists in 1937, originally observed that a bacteriophage VI phase 2 was acting on VI antigen of S. diffi. The parent phase is known as phase A. It could be made specific for a particular strain of S. diffi by serial propagation in that particular strain. As phage typing of S. diffi depends on the presence of VI antigens, some VI negative strains will be untypeable. A phage type is stable. At present, 97 VI two phase types of S. diffi are known, which are designated by letter or number. Phase types A and E1 are the most common in India. However, prevalence in different regions is subject to change from time to time. Phase typing is carried out at national phase typing centers. The National Salmonella Phase Typing Center for India is situated at the Lady Hardinge Medical College, New Delhi. Bacteriophage typing scheme for S type Paratifi A, S Paratifi B, S Tifimurium, S enteritidis, S Dublin have also been developed. The predominant phase types of Paratifi A isolated from India belong to type 1 and type 2. Now let's know about the biotyping. The serotypes can be subdivided into biotypes based on fermentation on xylose and arabinose. Now let's know about plasmid typing. Plasmids present in Salmonella are separated electrophoretically and analyzed. Now let's know about the treatment. Chloramphenicol has been the antibiotic of choice for enteric fever. Amoxicillin, ampicillin, furazolidine, and cotrimoxazole are also effective. Resistance to chloramphenicol and other antibiotics has been reported. Fluoroquinolones and the third generation cephalosporins are useful in such multi-resistant cases. Now, antibacterial therapy has been very effective in the treatment of patients, but it has been disappointing in the treatment of carriers. A prolonged course of antibacterial along with the vaccine has been tried in the eradication of carrier state. Chole- Cholecystotomy is indicated for chronic carriers who do not show any response to antibacterials. Now let's know about the drug resistance. Resistance to chloramphenicol became a problem in 1972 when resistant strains emerged in Mexico and in Kerala, India. In Mexico, the resistant strain caused an explosive epidemic. In India, chloramphenicol resistant typhoid fever appears as epidemic first in Calicut in 1972, that is in Kerala. It became endemic and remained confined to Kerala till 1978. Subsequently, resistant STP strains were reported in many other parts of India. Resistance was originally confined to phage type D1N but later to type C5 A and O. Resistance is due to a transmissible plasmid carrying R determinants to chloramphenicol, streptomycin, sulfonamide, and tetracycline. Multiple drug resistant STP is increasingly being recognized in many countries and has become a problem in India too. R factors carrying multiple drug resistant have become widely disseminated among Salmonella. This may cause nosocomial salmonellosis, particularly in neonates as septicemia, meningitis, and suppurative lesions. In India, hospital outbreaks of neonatal septicemia caused by multiple drug resistant salmonella have occurred in recent years. Mortality in neonates is very high unless early treatment is started with antibiotics. Now let's know about prophylaxis. Under this, let's know about the general measures. Typhoid fever can be effectively controlled by the sanitary measures for disposal of sewage, clean water supply, and supervision of food processing and handling. Infected meats and eggs should be thoroughly cooked. Carriers. Let's know about the carriers. Carriers should not be engaged in food preparation and should observe strict personal hygiene. Now let's know about vaccination. Vaccine is indicated for travelers or who live in endemic areas. Now let's know about TAB vaccine. It is heat killed whole cell vaccine which contains STP 1000 millions, S paratype A and B 750 millions each per ml and are preserved in 0.5% phenol. Now let's know about dose schedule. The vaccine is given subcutaneously in two doses of 0.5 ml at an interval of 4 to 6 weeks, followed by booster every 3 years. Now let's know about the protection. It varies from 3 to 7 years with an efficacy of 60 to 80%. Dose schedule. The vaccine is given subcutaneously in two doses of 0.5 ml at an interval of 4 to 6 weeks, followed by booster every 3 years. Protection. It varies from 3 to 7 years from years with an efficacy of 60 to 80%. Now let's know about the side effects. Local vaccine, local discomfort and fever may occur for 1 to 2 days. In India, a divalent vaccine containing STP and S paratype A are now in use. In Europe and USA, monovalent vaccine containing STP is employed as paratype A and B infections are rare in these countries. Now let's know about the live oral typhoid vaccine. In short, TY21A. Avirulent mutant strains of STP TY21A lacking the enzyme UDP galactose 4 epimerase has been used as a live oral vaccine. These mutants initiate infection in the intestine but self-destruct after 4 to 5 cell divisions and therefore cannot induce any illness. Now let's know about the dose schedule. 3 doses are given on alternative day. The oral vaccine Typhoral is available in capsule form containing 10 to the power 9 viable lyophilized mutant bacilli. Now let's know about the protection. It gives 65 to 96% protection for 3 to 5 years and is safe. Now let's know about the purified VI polysaccharide vaccine. Insert Typhim VI. It contains purified VI antigen. Dose schedule is it is injected intramuscularly in a single dose of 25 microgram, the efficacy is about 75%. Now let's know about Salmonella gastroenteritis. Salmonella gastroenteritis or food poisoning is generally a zoonotic disease. Therefore, the source of infection is animal product. All Salmonella can cause the disease except S. diffi. A large number of Salmonella have been identified from cases of gastroenteritis and food poisoning. S. typhimurium is the commonest species. Other common species include S. enteritidis, S. heidelberg, S. indiana, S. newport, S. halder, S. agona, S. Senftenberg, S. Virchow, and S. anatom. Now let's know about the sources of infection. The most important and frequent sources are poultry, meat, milk, cream, and eggs. It is due to ingestion of contaminated food. Food contamination may result from droppings of small animals like rats or lizards. Salmonella can enter through the egg or cell of the egg and grow inside. It happens when eggs are left on contaminated chicken feed or fishes. Hum- Human carriers do occur, but their role is minimal. Cross infection in hospitals may lead to gastroenteritis without food poisoning. Now let's know about clinical features. It presents with diarrhea, vomiting, abdominal pain, and fever. It has a short incubation period of 24 hours or less. Usually subsides Disease usually subsides in 2 to 4 days, but in some, a prolonged enteritis develops. Now, let's know about laboratory diagnosis. It depends on isolation of Salmonella from fishes and from food. Now, let's know about control. How to control this? It requires the prevention of food contamination. It may be achieved by proper cooking of food and control of natural infection in animals. Now, let's know about the treatment. Symptomatic treatment should be given. Antibiotics should not be used in on complicated non-invasive salmonellosis. This may not hasten recovery but may actually increase the period of fecal shedding of the bacilli. But for serious invasive cases, antibiotics are needed. Now let's know about Salmonella septicemia. Certain Salmonella may cause septicemia with focal suppurative lesions such as deep abscesses, osteomyelitis, pneumonia, endocarditis, and meningitis. Among all Salmonella, S. cholerae is particularly very important causative agent of Salmonella septicemia. It is a fulminating blood infection. Infection occurs by oral route. Salmonella may be isolated from the blood or from the pus from the suppurative lesion. Rarely, feces culture may be positive for Salmonella. These septicemic cases should be treated with chloramphenicol or appropriate antibiotics as determined by susceptibility test. Finally, Salmonella topic finished. Any questions regarding this? You can ask me in the comment box and subscribe my channel to know more about biotech topics. Thank you.